Hello and welcome to the program. I'm your host, Neal Howard. Our guest is Roseann Rook, here to discuss her work as a clinical addiction specialist at Timberline Knowles Residential Treatment Center, and that's located just outside Chicago, Illinois. She specializes in process addictions with a very strong focus on relationship addictions. Welcome to the program, Roseann.
Thanks, Neal. Thanks for having me. I think that this is a topic that's extremely important and often not addressed.
Now, you're a CADC. Is that something that you've always been interested in, or was there something personal that drew you to this particular profession?
There was a point, believe it or not, I was a travel agent for 14 years and knew that wasn't a passion and I needed to do something. And myself, actually, I am in recovery, have been for 31 years. And I I felt like that took me to a path and started to go to school and look at it, knowing there was more to someone that just drinks too much or does too many drugs. I knew there was so much more to that. So as I got into that and much more the clinical aspect, that is where my drive was. And when I started to get into the field, I knew that was my passion, but there was always this something's missing. Something's missing in our whole field of addressing, substance abuse. Mm-hmm. When we were talking, in the beginning it was all about drug and alcohol. That was my main focus. That's what I looked at. So that's where it started. That's where the actual it got me into that.
Now, you're in recovery.
Yeah.
I've met counselors who had no experience whatsoever with addiction on a personal level. It's all been clinical. Do you, having talked with other therapists, do you feel that you were at an advantage experientially when it comes to dealing with other addicts?
In some respects. And one that's really difficult is when you're dealing with a client or a resident, they put too much emphasis on that. They always want to know if you're in recovery. They think you'd only understand them if you were in recovery. And I make it very clear. We're basically all in recovery from something. Underlying issues that, bring people to use substances or any process addiction, we all have those. Some people just choose unhealthy coping skills. So, the only advantage I feel that I have is sometimes my terminology. It's kind of like, I feel like people, I realize it like in meetings, I always used to say like everybody in there, you could be making no sense. Everybody's kind of shaking their head because they get it. Mm-hmm. And I'm not saying a clinician wouldn't, but sometimes I think even my, and one thing I end up saying, that's how I end up letting them know I'm in recovery because I often say we. Mm-hmm. Instead of having to say you or addicts, it's kind of like, yeah, we think like this. And I could explain what somebody's thinking, and they're like, oh, my God, yes. So there are moments I notice that my experience, but I definitely want to make it clear that it does not make me a better clinician. Mm-hmm. I just think there is an advantage in there, yeah.
Define process addiction for me.
Okay, when we talk about a process, right, that's actually talking about moving an event. Basically, we're talking about behaviors, action or behaviors that become addictive, and they have the same characteristics. In fact, they fit the exact same criteria as substance abuse. And most commonly known, obviously, would be like gambling, work, sex, love and relationships. Mm-hmm. Technology has gotten huge. In every aspect, not just the computer and the phones. And so there's so many, and being in a residential setting like we are, and being where I'm working more of a clinical aspect in my groups, what's great about it is that as people talk, you can start to realize that they are, using certain other behaviors in the same exact way that they were using a substance. And really, they're pretty unaware of it.
Does the counseling and treatment, are the drug addicts with the alcoholics, with the sex addicts, with the workaholics? Or do you separate based on the different nuances of each addiction?
No, in fact, I think what's really, really important is not to be separated. We have a large population of women with eating disorders, self-harm, and then we've got also the people that are there for mood disorders with depression, anxiety, and bipolar. It's very common for people or addicts anyway to keep saying, well, they don't understand me, or I don't have that problem. Especially with the eating disorders. You've got the substance abusers saying, this is all about the eating disorders. I don't understand it. I think one of the benefits anybody in recovery has is to eventually realize that everybody is dealing with the same thing. So sometimes, like in my group, I kind of make it clear, and I say it, I don't care, because right now in this group, nobody's drinking, drugging, cutting, overeating, not eating, throwing up, or in bed. Okay? So outside of that, we're all sitting in the same stuff. Everybody in here has pain and shame and guilt and a history. And that's when you're here, is that commonality is what's being, we need to address. Everybody just, you're acting in a different behavior. And that's what's important to understand, because I know many people just don't understand addiction. And that's okay, because it doesn't make sense. To look at something, it's like, well, stop it. So
stop doing that.
But to understand, just, really, just if this is what's happening. But I think to hear, and that's another advantage, because I can see anything as an addiction and exactly give a parallel to any substance. And with that, I think there's a sense of, wow, it's not really that I made this choice to go do this. It's these issues, and look at how many people have the same issues. And I think that I've seen that it's really nice, because what I learned by coming to Timberline Knowles and treating all of these rather than purely substance is even my whole language changes, because I don't even like to say addicts, because that isn't even in the DSM-5. There's alcoholics not a diagnosis, addicts not a diagnosis. So I work really hard for them to take that title away, because that's what they're fighting. So I don't know. Let's worry about that name or this name. Let's worry about, do these particular behaviors cause you a problem? Let's look at this. And I've also told people, like, okay, look problem up in the dictionary. Do you want another one? Mm-hmm. You're here. So it's kind of like, okay, so problems need to be addressed. So let's just address it. So it's kind of like getting the boxing gloves off them. Yeah. I'm not defining any of this. And there's a sense of being able to sit back and look at it differently. So I think that part of it is important. And I've been just really amazed by me just using the terminology of, I call it pretty much acting out behavior. Any behaviors, because that way nobody's sitting there thinking, oh, well, that doesn't, include me, Oh, no, that's not me. It's like,
that's another question that I've been running around in my mind. I want to ask you this question from the standpoint of a person in recovery. How do you steer the conversation with someone else who has that mindset, I'm not as bad as him or her. I only snort cocaine. I don't use it intravenously, or I only use edibles. I don't smoke weed, or things of that nature. Right. How do you
Absolutely
get past that?
Well, first of all, it's never like, old school was confronting. That absolutely doesn't work. It's important there's an awareness. I can be I'm known to be extremely blunt, but caring enough that people usually are very appreciative that I could call them out on it. Mm-hmm. Sometimes it's more of a sarcasm, when someone will say, well, I only do this, and, I'll kind of say, like, yeah, people only steal small items. They don't steal big ones. Mm-hmm. So that's you know what I mean? Kind of looking at, and I also often bring that up in, like we're in a group talking. I do something now that's a newer group called the process of addiction, mm-hmm. which is different than process addiction. This whole angle comes that instead of having an addictive personality, that the personality develops as a result of the addiction. And you start to realize that people need to start manipulating, right, and lying and doing these things they do to be able to keep the addiction going. So basically, they've been hijacked. So when I work from this point and let them think, this is what brain starts to tell you, and then I'll give examples before they say it. Like, I only do this, and it's not as bad as this. I've also, when someone says, because think of this, somebody says, I'm not as bad as. So doesn't that mean you're bad?
Yeah, it does. Yeah. Okay.
I'm not, and I always stop them, I'm not as bad as. So that means it's bad. So does it, because it's not here, does that mean you don't treat it?
Absolutely.
Because this person has a gunshot wound, and this person has, a knife, been stabbed. I mean, is one bad as? So does it mean the other one's not treated?
I'd like to go online and get some more information about what you do there at Timberline Knowles Residential Treatment Center. Is there a website where we can go and get much more information?
Absolutely. It is www.timberlineknowles.com. And there's just a wealth of information, not just on what we do, but the articles that we post. You could get onto their web list, mailing list. We constantly have articles going in many, many different topics, which is helpful for those that aren't real educated. Mm-hmm. Also for family members, because there's so much they don't understand. And like I said, because it doesn't make a whole lot of sense. So there's a lot just in the website to people realize and how much we treat, how well-rounded, the amount of different type of therapies that are used. So, yeah, it's really informative.
I appreciate you coming in and talking with us today, Roseann Rook, and I'm hoping you'll come back and talk with us in the future.
I would look forward to that. Thank you very much, Neal.
Thank you. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm.